Welcome back. You have kept the COVID-19 questions coming, so we are going to keep trying to answer them. And tonight, it's all about trying to game out the next few weeks as Canada continues to gradually reopen for business. So joining me tonight, infectious diseases expert, Dr. Lenora Saxinger. And Dr. Saxinger, this first question here is all about finding the prudent path forward. How will youth team sports return safely? I mean, hard to physical distance when you're playing basketball, right?
Yeah, I think that is starting to become a bigger question for a lot of people. And I think there's parts of it that are kind of easy where you say, well, can we minimize the time off court where you're in close quarters? Can we change the way that people dress for the game and avoid dressing rooms? But I think there's a lot of unanswered questions about transmission in the setting of a contact potential sport and whether virus in saliva could pose a risk to other players and how you might reduce that risk. And I guess the other issue around youth and children is that we still, I think, lack information on the amount of infection that might be asymptomatic in kids and youth and whether that's contributing to community spread. So to me, I think any discussion would have to be kind of preliminary until some of those fundamental questions get a bit more science behind them, honestly.
Right, and I guess you got to wonder, I mean, would masks, would something like that even help?
I think that there's some ways you might imagine this can be made safe and that people can return to these healthy, fun activities, but I am actually hesitant to say that it's for sure safe at the moment because there's just too many unknowns and we're still working on the whole children and youth angle for what that means in the context of a community epidemic.
Similar sort of question. Is public transit going to be a complete mess? How can you avoid being so tightly packed around other people, I suppose, once things really get going?
Yeah, I was looking at some clips from the UK where the subway is such an important part of everyone getting to work. And I think that there are definitely some concerns there. And there's some questions around airflow and enclosed spaces and how much that might increase risk. It's also unknown how much masking might decrease risk. If we had a better idea of that, it would be a little bit easier as well.
Right. And so one other question here, sort of about the day-to-day life. How would we have our cleaning lady come do her job safely? Or is that a bad idea?
I think that one's a bit easier because if you can avoid sharing airspace while someone's in your house and everyone avoids going out if they're ill, it should be reasonable because especially if you can be out of the house when she comes in and you don't spend time in the same area, it seems reasonable to me to have that happen still.
Okay, yeah, fresh droplets, as we've heard often about the primary vehicle of transmission. Dr. Saxinger, thanks so much for your time.
Welcome.
And as we've mentioned, we will be asking your questions about COVID-19 as often as we can. So send those questions in. You can reach us on Instagram @CBC The National or by email at covid@cbc.ca.